Hi, my name is Amanda Garcia, and I will be discussing alcoholism and if abstaining from alcohol is the only cure for alcoholics. Today, there are several myths circulating the reality of alcoholism, such as when the alcoholic becomes impaired, their true feelings will come to light. According to Dr. James R. Millam and Catherine Ketchum, this is not true. This happens because the alcohol affects the brain, causing psychological and emotional distortions. Once the alcoholic is sober, that's when their true feelings are revealed. I will discuss a few articles research over abstinence and if abstaining from alcohol is a solution for the alcoholic or is a myth. Also, I may refer to the alcoholic as a patient. An article explains when the alcoholic decides to abstain from alcohol, he will undergo withdrawal phases. The first phase they will experience is called acute withdrawal, and this usually occurs within the 48 hours with a peak of 24 hours since the patient's last drink. This is where the nervous system's hyperexcitability becomes affected. The hyperexcitability is then dominated by autonomic nervous system's hyperactivity, which may cause tremors, seizures, or delirium tremens. Delirium tremens is when the patient experiences profound confusion, tachycardia, or even hallucinations that could last up to 8 days. The next phase is called early abstinence. This is used in reference following the period of the patient's low mood, depression, and insomnia. These symptoms continue, but with the absence of acute symptoms. This phase usually subsides over 3 to 6 weeks after the patient's last drink. The final phase is called the protracted abstinence, where the brain's serotonin and endorphin levels are low, which depression and anxiety may continue. The patient may experience a shift in affective processing, causing challenges such as cravings and even relapse. An alcoholic who chooses to abstain from alcohol will undergo the withdrawal phase, and yet some who have difficulty may involve repeated cycles of the withdrawal process. Researchers and scientists have been researching abstinence from alcohol for many years. A magazine article discusses a few studies, and the results are quite controversial. First, Landmark Research at Penn State University conducted a study which was intended to prove that alcoholics can be trained to drink moderately. Later during that study, the participants continued to drink and to show problems with drinking. Another study in 1980, the Rand Corp suggested that men, in particular, who were not solemnly dependent on alcohol, sustained a better chance to become moderate drinkers, with no greater chance of relapsing completely rather than abstaining completely. Another article discussed that abstinence is associated with anxiety and depression. The Hunt study in Norway conducted an analysis of 38,350 participants and their alcohol consumption within the past 2 weeks. They found that both abstainers and heavy drinkers experienced anxiety and depression than mid-range drinkers. Also, the study showed that some abstainers had previously been heavy drinkers. However, the exclusion of previous heavy drinkers reduced the level of association between abstinence, depression, and anxiety. This study demonstrates that abstaining from alcohol is not a cure, but in fact can cause anxiety and depression. I have previously witnessed an alcoholic undergo the withdrawal phases, and it's not easy for them or their family. My sister was unwittingly admitted to the hospital for potential drug overdose and alcohol poisoning. When she arrived, she was unconscious, and the doctors had to pump out a lot of fluids in order for her body to detox. She also had to be sedated a few days to calm her down because she was experiencing delirium tremens and hallucinating. I realized that this is why many alcoholics choose rehab treatments because the withdrawal phase is difficult and they need professional attention. The doctors had told my sister that she was very lucky to survive, but after a month, she continued to drink. Within the month of not drinking, she experienced anxiety and depression. She had been an alcoholic since her teens, and with her potential overdose was with Tylenol, so that had a major impact on her liver. She had cirrhosis and was in need of a transplant. But even with her condition, she still continued to drink. She later applied for disability, and the doctor recommended us to put her in hospice at the age of 38. Although many believe that abstaining from alcohol is the only cure, the following studies prove it as a myth because the results show that not all patients recover completely. Studies even show that abstaining can lead to other health problems and even death. The thought of abstinence may actually drive the patient away from treatment. Alcoholism affects many people, and I believe they must have the desire to overcome the illness by all measures necessary.